Ultrasound machine knobology tips. Legal disclaimer: information is for general and educational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained, and expressly disclaim liability for errors and omissions. This topic is important because it explains the functions of the various ultrasound system controls and knobs and the impact they have on grayscale ultrasound imaging. It demonstrates the effect of transducer selection on image quality and the role of knobology variables in imaging or image optimization. Emphasizes the potential detrimental effect of underutilizing ultrasound knobs and system controls in abdominal sonography. Choosing the right ultrasound probe is very important according to the type of exam being performed. The single most crucial factor for obtaining proper ultrasound images is selecting the appropriate ultrasound probe or transducer. The choice of probe significantly impacts the image quality and visibility of structures. Different probes are suited for various applications, with factors such as resolution, penetration depth, and footprint size being crucial considerations. For example, a linear probe offers high resolution but limited depth, making it unsuitable for visualizing deeper structures like the heart. So it's typically used for superficial or shallow structures such as vessels and other areas like breast and etc. Before scanning, it's essential to ask questions like the purpose of the ultrasound, depth of structures to visualize, and whether it involves a procedure or cavity. Each probe has its advantages and disadvantages, and understanding how factors like frequency affect penetration and resolution is essential in making the right choice. So the ultrasound probe footprint is actually just the area on the probe that comes in contact with the patient's skin to produce an ultrasound image. It's located at the tip of the probe and usually has a soft rubbery feel. Depending on the application, you may want a smaller or larger footprint. Regarding footprint width from largest to smallest, it goes from curvilinear to phased array. Those are different types of transducers. The curvilinear ultrasound probe has a frequency range of 2 to 5 megahertz. It is considered a low-frequency probe and has a large or wide footprint, allowing for better lateral resolution compared to the phased array probe. It's often used for abdominal and pelvic ultrasound exams. However, it can also be used for cardiac and thoracic ultrasound exams, but is limited by the large footprint and difficulty with scanning between rib spaces. The linear ultrasound probe is a high-frequency transducer. The megahertz are from 5 to 15 megahertz. That will give you the best resolution out of all the probes, but is only able to see superficial structures. A general rule of thumb is that if you are going to ultrasound anything less than about 8 centimeters, then use the linear probe. Anything above 8 centimeters in depth, you won't be able to see much. A linear probe will give you a rectangular field of view that corresponds with a linear footprint. The phased array or sector ultrasound probe is commonly branded the cardiac probe and has a frequency range from 1 to 5 megahertz. Has a similar frequency range as the curvilinear probe, but a smaller and flatter footprint. The advantage of this probe is that the piezoelectric crystals are layered and packed in the center of the probe, making it easier to get in between small spaces such as the ribs. It's the ideal probe for cardiac scanning, however, it can perform all of the applications that the curvilinear probe can as well, with less lateral resolution. Endocavitary ultrasound probe has a curvilinear footprint with a wide view, but has a much higher frequency, such as 8 to 13 megahertz, than a curvilinear ultrasound probe. The image resolution of the endocavitary probe is exceptional, but like the linear probe, it must be adjacent to the structure of interest since it has such a high frequency and resolution, but poor penetration. The most common POCUS application or point-of-care ultrasound application for the endocavitary ultrasound probe are for intraoral peritonsillar abscess and transvaginal applications, early pregnancy, ovarian torsion, ovarian cysts, fibroids, and ectopic pregnancy, etc. Make sure to always place a sterile endocavitary probe cover, condom, or glove prior to scanning. All-in-one handheld ultrasound probes. Ultrasound probes just described are for traditional cart-based systems. However, there are now handheld devices that connect to smartphones and can simulate multiple probe types with just a click of a button. Butterfly ultrasound device is an example of this. The footprint is slightly larger than a phased array, and the weight of the probe is about 2 to 3 times more than a typical phased array. This increased weight is accounted for by the processor and the battery. Ultrasound probe movements and manipulation. One of the movements that is commonly used is sliding the ultrasound probe. It involves moving the entire probe in a specific direction to find a better imaging window. This is usually used to find the best window and move to different areas of the body or follow a specific structure such as a vessel. Tilting or fanning the ultrasound probe involves moving the transducer from side to side along the short axis of the probe. It's commonly called fanning as well. Tilting will allow visualization of multiple cross-sectional images of a structure of interest. You can apply this technique to structures such as the heart, kidney, bladder, vessels, etc. Rotating the ultrasound probe involves turning the transducer in a clockwise or counterclockwise direction along its central axis. Rotation is most commonly used to switch between the long and short axes of a specific structure such as a vessel, the heart, the kidney, and etc. You can also rock the ultrasound probe. It involves the ultrasound probe either rocking it toward or away from the probe indicator along the long axis. Rocking allows you to help the center the area of interest. This is also referred to as in-plane motion because the image is kept in plane throughout the manipulation. Compression with the ultrasound probe involves putting downward pressure on the probe to evaluate the compressibility of a structure or organ of interest. The most common use is to evaluate for deep vein thrombosis, differentiate between artery versus vein, and evaluate for appendicitis, which is non-compressible. Influence the ultrasound equipment, knobology, and abdominal sonography. Switching on the ultrasound machine. The initial step upon switching on the ultrasound machine is to press the power knob. This provides electrical power to the ultrasound system, activating the piezoelectric crystals within the connected transducer. These crystals emit sound waves when stimulated by electricity. To transmit these waves into the body effectively, a coupling gel is typically used to remove air and ensure proper acoustic contact between the transducer and the skin. So make sure you know how to properly turn on and off your equipment. The initial step upon switching on the ultrasound machine is to press the power knob. This provides electrical power to the ultrasound system, activating the piezoelectric crystals within the transducers. These crystals emit sound waves when stimulated by electricity. To transmit these waves into the body effectively, this is the purpose of why we use gel. The gel acts as a coupling agent and typically is used to remove air and ensure proper acoustic contact between the transducer and the skin. So make sure when you're starting your exam, you select your proper application preset according to the type of exam you're performing. The presets allow for streamline of the examination process across various medical specialties. By selecting the appropriate preset for a specific examination type, such as abdominal sonography, operators can quickly activate factory settings tailored to the unique requirements of that examination. This not only saves time, but also ensures adherence to ALARA, which means as long as reasonably achievable. Ultrasound physics term that everybody that performs ultrasound should abide by. It minimizes unnecessary adjustments, also by selecting the proper application preset. However, using the wrong preset for an examination may compromise image quality and interpretation accuracy. Therefore, careful consideration and proper selection of presets are essential to achieving optimal results in ultrasound imaging. Ultrasound imaging relies on high-frequency sound waves emitted from transducers, typically ranging from 1 to 15 megahertz. The frequency of the transducer affects both resolution and depth penetration, with higher frequencies offering better resolution but limited depth and vice versa. In abdominal examinations where deeper penetration is necessary, lower frequency transducers are performed. However, this may result in poorer resolution. Operators must carefully balance resolution and depth penetration when selecting transducers, considering factors such as patient size and cooperation level. Linear transducers with higher frequencies are also used for superficial structures in abdominal imaging. Ultimately, the choice of transducer frequency plays a crucial role in achieving optimal image quality and diagnostic accuracy in abdominal sonography. The output power. Operators must carefully consider the acoustic output power of ultrasound machines during examinations, ensuring adherence to ALARA principles while maintaining image quality. Selecting appropriate presets for specific examinations can automatically adjust output power levels, but operators should avoid compromising image quality for power reduction. Striking a balance between maximizing image quality and minimizing output power is essential to mitigate the risk of biologic effects. Monitoring output power levels displayed on the ultrasound machine screen allows operators to stay informed, but adjusting overall gain may offer a safer and more effective means of optimizing image quality. The overall gain. Instead of increasing the output power, adjusting the overall gain is recommended for optimizing ultrasound image quality. Acting like a microphone, it amplifies echo signals without increasing transmitted sound energy, improving contrast resolution. While essential for image optimization, care must be taken to avoid excessive brightness, which can degrade image quality. Most modern machines integrate overall gain controls, allowing for precise adjustment to achieve optimal results. TGCs, or time gain compensation. While overall gain adjusts brightness across the field of view, it may not adequately address attenuation at specific depths. Structures affected directly or differently by attenuation require depth-specific compensation. Provides depth-specific adjustments for echo signal amplification, enhancing axial resolution and brightness uniformity. Centering TGC settings before overall gain adjustment ensures optimal compensation for depth-specific attenuation. So paying attention to the focal zone is a very important aspect when you're trying to optimize your images. Within the focal zone, the resolution is going to be the clearest within the focal zone. So adjusting the focal zone during scanning aids in improving lateral resolution in a region of interest, minimizing attenuation effects. The focal zone adjustment is more effective for lateral resolution. Proper placement of the focal zone enhances resolution throughout the field of view, but selecting multiple focal zones may decrease the frame rate and scanning time, potentially compromising temporal resolution. Balancing these factors is essential for optimal imaging while adhering to ALARA principle. Adjusting the depth knob allows for optimal visualization of structures within the field of view, ensuring the region of interest is well defined and irrelevant areas are excluded. Prioritizing structure of interest occupies 2/3 of the field view, while adjusting the depth for far field visualization minimizes the risk of missing pathology. However, moving the depth closer may introduce noise and affect contrast resolution, potentially mimicking pathology. Balancing depth adjustments is crucial for accurate diagnosis and imaging quality. So the zoom application magnifies the area of interest by making it appear larger, overcoming limitations of depth adjustment for precise visualization of tiny structures. For accurate measurements, zoom enhances spatial resolution, such as in measuring gallbladder wall thickness. Different zoom types like read and write affect image quality differently. Right zoom, involving live zooming, generally preserves spatial resolution better than read zoom, which relies on stored images. Operators should understand that their machine's zoom type to maximize its use without compromising image quality. Dynamic range. Adjust the range of shades of gray displayed on the monitor, impacting image contrast. A broad dynamic range displays a wider range of echo intensity, producing smoother images suitable for assessing soft tissue structures like the liver and pancreas. Narrow dynamic range, displaying a narrower range of echo intensity, is better for assessing anechoic structures such as the aorta and IVC, enhancing contrast between different regions of echogenicity. Matching dynamic range to the type of structure being assessed optimizes image quality for diagnostic purposes. Tissue harmonic imaging, an additional control for image optimization. It improves image quality by eliminating weak echoes that cloud the image when the fundamental frequency of the transducer is used. It replaces the returning echoes from the fundamental frequency with echoes in the harmonic frequency, which improves spatial resolution. It eliminates side lobe artifacts and noticeable noise in the area of interest. It can therefore be used in conjunction with the utilization of other knobs that may generate noise. Freezing in cine loop enables the operator to stop and evaluate the image quality before storage. Saving an image without freezing implies that the image was not evaluated for quality. Freezing the image before storage is therefore recommended. An additional control that helps with selecting the best of the image frozen image. It displays image frames acquired in the last few seconds prior to freezing. Can be highly useful when scanning children. Additional controls for imaging abdominal blood vessels. Abdominal ultrasound examinations often involve assessing blood vessels and Doppler evaluation of blood flow. Key knobs influencing both color and spectral Doppler imaging include Doppler gain, PRF, and wall filter. Adjusting or making adjustments for smaller vessels typically involve higher Doppler gain, lower PRF, and lower wall filter settings, balanced to minimize noise artifacts. For larger vessels like the aorta, imaging angle control is crucial. In spectral Doppler, aliasing artifacts due to low PRF can be correlated by adjusting PRF in baseline settings. Careful manipulation of these controls ensures accurate assessment of blood flow in abdominal ultrasound examinations. So in conclusion, selecting the right ultrasound probe is crucial for accurate imaging, considering factors like application, depth, and footprint size. Understanding the advantages and limitations of probe types ensures optimal diagnostic outcomes. Mastering probe movements and manipulation techniques like sliding, tilting, enhances imaging quality across clinical applications. Knobology plays a vital role in optimizing image quality in abdominal sonography, with controls for frequency, gain, and dynamic range. Doppler evaluation requires careful control manipulation to minimize artifacts. Mastery of knobology principles ensures efficient abdominal imaging and better patient care.